All right, welcome to another deep dive. We are diving into some pretty heavy stuff today. We're going to be looking at the U.S. and the possibility of them withdrawing from the World Health Organization.
Big implication.
Yeah, huge. And we've got a ton of stuff to get through. News articles, we've got online discussions, even some stuff from the Financial Times, and the opinions are, well, they're all over the place.
It's a big decision, right?
Yeah.
I mean, the WHO is pretty central, to a lot of these
Huh.
global health initiatives, especially when we think about pandemics and responding to those.
Right.
And when you thought about it, the U.S. contributes like a significant chunk of their budget, 16%.
Mm.
So pulling out, it's not just symbolic, it makes you think, what does this mean for the U.S. and their role, especially when it comes to global health?
Yeah, it makes you wonder. And, what's interesting is this isn't a brand new idea. Back in 2020, peak COVID, President Trump, he actually started the process of withdrawing. He was citing concerns about the WHO's relationship with China.
Yeah, it's true. And President Biden, he reversed that decision, right, when he came into office. But the fact that it's like come up again, yeah, I think it suggests that there's something deeper here, this ongoing debate. Is this a sign of a larger shift, when it comes to U.S. foreign policy, or are there like specific factors that are at play this time around?
Well, there's this quote from the Financial Times. They quote a source who's like close to the transition team. And the source says, the same WHO that we left in the first administration, it seems like we wouldn't much care what they have to say.
Hmm.
So that kind of hints at like a lingering distrust, maybe.
Yeah, and you have to think about this potential move. It's happening, while there are all these other significant changes. Think
Yeah.
about the recent appointment of Robert F. Kennedy Jr.
Oh, right.
to head the U.S. Department of Health and Human Services,
Mhm.
and he's someone who's publicly questioned vaccine safety.
Yeah, that's a big one. And it's interesting because you see these comments online, and some people are suggesting that this is all about optics. Like it's a way for the incoming administration to distance themselves from President Biden's policies and, kind of signal a change in direction. But is it really just symbolism? Or could there be more to it?
Oh, there's definitely more to it.
Yeah.
A lot of experts are worried that if the U.S. pulls out, it would leave this massive void when it comes to global health leadership and funding. Imagine if the organization that's like responsible for responding to outbreaks, Ebola, Zika, all of that, imagine if they suddenly lost their biggest contributor.
Yeah, that's a scary thought. And some people are even saying that this could give China an opportunity to increase its global influence. I saw one comment on Reddit. Someone was saying this is China's chance to step up, fund healthcare programs in developing countries, basically kind of fill the gap left by the U.S.
It's true. That brings up some really interesting questions about geopolitics, and we'll definitely dive into that a bit later. But first, I think it's really important to understand just how much the WHO does, how involved they are in so many different aspects of global health. We're talking about developing vaccines, distributing them, tracking diseases, coordinating emergency response. I mean, they do a lot.
Yeah. One comment that really hit me was it was from a marine biologist. And they were saying that they rely on the WHO's global networks. They use it to study things like harmful algal blooms. And they were worried, what if the US pulls out? Would that disrupt their research? Would it disrupt the ability to respond to these kinds of environmental health emergencies?
It's a good example of how interconnected all these issues are. And the concerns go beyond just these, immediate disruptions. You see a lot of people talking about the potential for a resurgence of diseases like polio, measles. They're worried that if vaccine skepticism grows, because of these shifts in U.S. health policy,
Right.
then, we could see those diseases coming back.
And it's not like those diseases are going to stay within the U.S., right?
Exactly.
Even if that hesitancy primarily increases in the U.S., it could easily spill over and affect other countries, especially those with close ties to the U.S.
Yeah. And while a lot of the discussion is focused on that global impact, we can't forget about the potential consequences for the U.S. itself. I mean, the U.S., they benefit from the WHO's disease surveillance programs.
Right.
They benefit from global health initiatives, especially when it comes to preventing and responding to pandemics.
Yeah. It's interesting because so many of the comments online are echoing that sentiment, especially after what happened with COVID-19. They're talking about those early warnings from the WHO, the ones that were allegedly downplayed or ignored by the US administration. They're worried that without active engagement with the WHO, the US might be more vulnerable to future pandemics.
That's a valid concern. And on a broader level, I think we have to think about the impact on the U.S.'s soft power. That ability to influence global affairs through persuasion and cooperation rather than force. If the U.S. steps back from this global health leadership role, is that a sign that they're shifting towards a more isolationist approach? And what kind of ripple effects could that have in other areas of international relations?
So it seems like we're looking at this really, really complex web of health and politics and international relations. And even though the motivations behind this potential move are still up for debate, there's just a lot of anxiety about what a U.S. withdrawal from the WHO could mean for the U.S., for the world. I mean, for everyone, really.
Absolutely. There was one comment that I saw that really stood out to me. Someone was asking, is the U.S. truly prepared to handle the next pandemic, especially with, threats like avian flu on the horizon? Can they really do it without the support and collaboration of the WHO?
Yeah, that's a big question. That's a question we're going to need to explore further.
Well,
But before we do, let's take a closer look at some of the specific concerns people have raised about the potential impact on the U.S. itself. For instance, remember those tariffs, the ones that were imposed during the first Trump administration? Well, there was this one Reddit user who pointed out that those tariffs, they could actually make it harder for the U.S. to respond effectively if there's another pandemic.
oh, wow. Okay. How so?
Well, those tariffs, they really disrupted global supply chains.
Right.
And that includes, the ones for essential medical supplies.
Uh-huh.
So think about it. If another pandemic hits and the U.S. needs to really ramp up production, things like masks, ventilators, maybe even certain medications,
Yeah.
they could face some serious delays and shortages because of those messed up supply chains.
Huh. See, I hadn't even thought about that.
Yeah. It's like a wake up call, isn't it? Like these global systems, they're way more connected than we often realize.
Right.
We kind of think about health as its own separate thing, but it's so tied to trade, to economics. I mean, even international relations.
Exactly. It's all connected.
It's all woven together.
Yeah.
And these potential consequences, they're not just theoretical or abstract. This is real. This has real implications for people's lives.
Right.
Remember that marine biologist we were talking about earlier?
Yeah.
They were sharing how worried they were about the impact on their work, their research, concerned about things like disruptions to funding, to data sharing, even access to important equipment if the U.S. pulls out of the WHO.
It's true. It's easy to get caught up in these big picture policy debates.
Right. But it's those stories, those personal stories that really hit home. These are real people whose lives, whose work could be seriously affected by this decision.
Absolutely. And it's not just researchers, right? Think about all the healthcare workers, public health officials, organizations all around the world. I mean, they rely on the WHO for support, for guidance, for resources. What happens to all those collaborations, those partnerships, if the U.S. withdraws?
Yeah. It does feel like there's a lot of uncertainty, a lot of anxiety surrounding this potential decision. But
Wow.
is there any good news? Is anybody talking about ways to soften the blow, ways to mitigate these potential negative impacts?
It's interesting because even with all the concern, there's also this sense of resilience, of determination you see coming through. Yeah.
Yeah.
That same marine biologist, even though they were, expressing those worries, they also talked about how their research community, they're already looking into other ways to keep the science going.
Wow, that's impressive. So what kind of alternatives are they considering?
Well, they mentioned possible collaborations with institutions in South Korea, in Australia,
Oh, okay.
and even increases in research funding from Japanese agencies.
Interesting.
It seems like the scientific community, at least in this case,
Mm.
they're not just sitting around waiting to see what happens. They're actively trying to find ways to adapt, to overcome these potential challenges.
That's really inspiring. It speaks to, their dedication, the ingenuity of the people who are working in global health. That commitment to finding solutions even when things are uncertain.
Yeah, and it also highlights how important it is to diversify. You know, if the U.S. does pull out of the WHO, it underscores the need for other countries to step up to fill that leadership void.
Hmm.
This could be a chance for new partnerships, new alliances.
Yeah.
Maybe even leading to more innovative and more collaborative ways to approach these global health challenges.
So what we might be seeing is a shift in the whole landscape of global health, with the U.S. maybe taking a step back and other players stepping forward.
Yeah,
But that doesn't necessarily mean progress is going to stop, right? It might just look different.
exactly.
New leaders might emerge, new collaborations might form.
Exactly. And this brings us back to something we talked about a little bit earlier, the importance of individual action.
Yeah.
It doesn't matter what happens at the government level. We can each play a role in supporting global health initiatives.
I love that. It's empowering to remember that we're not just, sitting back and watching this happen. We can actually make a difference. But for those people who are feeling, kind of overwhelmed by it all, where do they even start?
Well, there are so many ways to get involved. You can donate to organizations that are working on the front lines of global health issues. You can advocate for policies that promote health equity,
Hmm.
or even just stay informed.
Yeah.
Stay engaged with these topics. Even something as simple as having thoughtful conversations with friends and family about these issues can raise awareness and maybe even inspire action.
Those are great suggestions. And as we've seen from this deep dive, even just staying informed and really thinking critically about the information that we're taking in,
Yeah.
that can be a powerful act in itself.
Absolutely. And one way to do that is to really examine the arguments that are being made about this
Hmm.
potential US withdrawal from the WHO. Why is this even being considered? Is it purely symbolic, like some people are saying, or are there deeper concerns that are driving this decision?
It seems like there's a lot to unpack there. We need
Yeah.
to, look past the headlines, really dig into the evidence that's being presented.
Hmm.
And as you said earlier, we also need to be wary of misinformation, of manipulation.
Yeah, yeah.
With social media, it's so easy for false or misleading information to spread and to influence, public opinion.
That's true.
So we really have to be careful.
It's crucial to be, discerning consumers of information. We need to verify sources, to consider different perspectives, and just think critically about the information that we come across.
So we've covered a lot here. The historical context, the potential reasons why the U.S. might withdraw, the impact it could have on both global and domestic health, and the importance of individual action. But there's one really crucial aspect that we haven't really touched on yet, and that's the ethical dimension of this whole decision.
That's a profound point. If the U.S., I mean, the wealthiest nation in the world,
Right.
a major contributor to global health initiatives, if they decide to withdraw from the WHO, what does that say about their moral obligations to the rest of the world?
Yeah, it's a heavy question. It really is. And it's not one that has an easy answer, especially given the fact that, diseases, they don't care about borders.
Yeah.
So is there a moral imperative for wealthy nations to support global health, especially in a world where a health crisis in one part of the world can quickly become a global concern?
And if so, what are the limits of that obligation? Where do national interests end and global responsibilities begin?
This is bringing up so many questions, and I don't know if there are easy answers, but it does feel like this situation is kind of forcing us to confront some really fundamental questions about global citizenship and responsibility.
Mhm.
What do you think?
I completely agree. And it's not just about the U.S., right? This decision, it could set a precedent for other nations,
Hmm.
potentially leading to a weakening of global health cooperation and maybe even a retreat from multilateralism.
Right.
That idea of countries working together to solve these shared problems.
It's almost as if this whole decision is like a microcosm of these larger global trends that we're seeing.
Yeah.
Rising nationalism, skepticism towards international institutions, this prioritization of national interests over global cooperation.
Yeah.
And that's what makes this deep dive so fascinating, I think. It's not just about analyzing one decision.
Right.
It's about understanding the forces that are shaping the world that we live in and what this shift could mean for the future.
Exactly. And for anyone listening, I really encourage you to engage in these conversations, to challenge your own assumptions and to think critically about the information that you're consuming.
Hmm.
We are just bombarded with news and opinions all the time,
Yeah.
and it's easy to feel overwhelmed
Yeah.
and just retreat into our own little echo chambers.
That's exactly why we do the deep dive.
Right.
We want to empower you to navigate this complex world, to be informed and engaged citizens who are capable of forming your own well-informed opinions.
And remember, even if you don't have all the answers, just asking the right questions is a powerful thing to do. It's a
Yeah.
way of taking part in shaping our collective future.
So as we wrap up this deep dive, I
Yeah.
want to leave you with one final thought. What
Yeah.
what strikes me most about this whole conversation is just how interconnected everything is.
Health isn't just about, biology. It's about economics. It's about politics, international relations, even ethics.
It really is.
And while this particular situation feels very, very much up in the air right now,
Yeah.
it gives us a valuable opportunity.
To pause and reflect on our values and priorities, both as a nation and as individuals in this globalized world.
Exactly. This isn't just about a potential withdrawal from the WHO.
Right.
It's about asking ourselves, what kind of world do we want to live in?
Mm-hmm.
And what role do we want to play in shaping that world?
And on that note, we'll leave you to ponder those questions.
We encourage you to dig deeper, to challenge assumptions, and to engage in those thoughtful conversations about these really crucial issues.
Stay curious, stay informed, and stay engaged.
And remember, even small actions can make a big difference. Until next time on The Deep Dive, keep exploring.
Yeah, it is easy to get kind of swept up in the immediate news and the potential fallout from this decision. But I think you're right. Zooming out and looking at the bigger picture here is really important.
Well, what's really interesting to me is that this whole situation, it kind of forces us to confront some really basic questions about, how do we govern a globalized world in the 21st century, right? We're dealing with all these increasingly complex and interconnected challenges, pandemics, climate change. Can we really tackle those effectively without strong international institutions and
Yeah.
a willingness to cooperate?
I mean, that's a huge question. Honestly, I don't think there's a simple answer to that. There's a real tension, right, between the idea of national sovereignty, countries wanting to do their own thing, and then this need to work together on a global
Yeah.
scale.
Exactly. And this decision about the WHO, it sits right at the heart of that tension. If the U.S., a country that's historically played a huge role in shaping global institutions, if they decide to go it alone, what kind of message does that send to the rest of the world?
It does make you wonder. Does it embolden other countries who are maybe, leaning towards more isolationist approaches, or could it create an opening for new global leaders to kind of step up, for new models of global governance to be explored?
It feels almost like a fork in the road, not just for global health, but maybe for international relations as a whole. And I think that's what makes this whole deep dive so thought-provoking. It's not just about picking apart this one decision. It's about understanding the forces that are shaping the world that we live in, and what this shift might mean for the future.
And that's exactly why we do the deep dive, right? We want to equip our listeners with the knowledge and the insights that they need to navigate this complex world that we're living in.
We want you to be informed, to be engaged citizens,
Yeah.
Capable of critical thinking and making well-informed decisions, even amidst all the noise and all the conflicting opinions out there.
And remember, even if you don't have all the answers, just asking the right questions is a powerful first step. It's a way of participating in shaping our collective future.
So as we wrap up this episode, I'll leave you with one final thought. The world is changing so rapidly, and the old ways of doing things, they may not be enough anymore. This situation with the WHO, as concerning as it is, it could also be a catalyst for positive change.
That's an interesting way to look at it. How so?
Well, it's a chance to rethink global health governance, to create more equitable and more effective systems that prioritize the well-being of all people, no matter where they live.
That's a very hopeful and empowering way to think about it. And on that note, we'll leave you to continue exploring these ideas and engaging with the world around you. Thanks for joining us on the Deep Dive.
Until next time, keep learning, keep questioning, and keep diving deeper.